Imagine a tiny growth, no larger than a pea, expanding inside your digestive tract. You wouldn't feel it. There is no pain, no discomfort, and no reason to suspect anything is wrong. Left undisturbed, this microscopic anomaly can transform into one of the most lethal diseases on the planet, colorectal cancer. Doctors are now observing a concerning trend. They are diagnosing this disease in younger adults at a higher rate than ever before, often in patients with zero obvious risk factors. Colorectal cancer exploits a prolonged, invisible early stage to establish a foothold before the body can mount any defense. This map shows the lower digestive system. After food clears the stomach and small intestines, it reaches the colon, the large intestine, and finally the rectum. These organs manage water absorption and waste storage. The disease begins as a polyp, a small bump growing outward from the inner lining of the colon wall. Initially, the vast majority of these growths are harmless. This timeline tracks the biological countdown. Over 10 to 15 years, a subset of these polyps acquire genetic mutations. The abnormal cells divide, the mass grows, and the cellular structure becomes increasingly chaotic. This decade-long mutation sequence happens in total silence. Your body registers no pain and produces no outward symptoms to alert you to the growing danger. This slow 10-year biological sequence allows the disease to reach a critical mass without ever alerting the host. Eventually, those abnormal cells cross a critical threshold. The harmless polyp becomes a cancerous tumor, and the silence finally breaks. This diagram shows the mechanics of the first alarm. As the tumor expands, it pushes into local blood vessels in the colon wall. The pressure tears these delicate structures, leaking tiny, sometimes invisible amounts of blood into the stool. If the bleeding is visible, it may appear bright red or as dark, tarry patches. Patients often assume these are simple hemorrhoids, unintentionally ignoring a major internal warning. Continuous hidden blood loss triggers a chain reaction. As the leak depletes your red blood cells, oxygen delivery across the body drops, inducing iron deficiency anemia. Without sufficient oxygen, you experience profound, unexplained fatigue. You might feel weakness or shortness of breath during daily tasks, symptoms often wrongly attributed to normal stress or aging. That persistent exhaustion is an indirect SOS signal for mechanical damage happening inside the digestive tract. This top-down view shows the tumor acting as a physical barricade inside the colon's waste pipeline. Because the passageway is restricted, normal rhythm is disrupted. Stool squeezes through a narrow gap, leading to persistent constipation, diarrhea, or pencil-thin stools. The growing mass triggers tenesmus. The tumor's physical weight irritates local nerves in the rectum, sending a continuous false signal to your brain that the bowel is full, even after you have used the restroom. Simultaneously, your immune system recognizes the cancer and mounts a defense. This biological response consumes enormous amounts of energy. Between the tumor's growth and the immune response, your metabolism shifts. Appetite decreases and weight falls without any change in diet. Localized changes in bathroom habits and rapid weight loss are the direct consequences of a tumor siphoning off biological energy. If these signals go ignored, the tumor continues its expansion deeper into the layers of the colon wall. Eventually, the cancer cells push through the barrier of local blood vessels and lymphatic channels, entering the body's internal transport systems. Once swept into the bloodstream, the cells can travel to other organs. They seed new secondary tumors in the liver, lungs, or bones, a process called metastasis. This cellular escape transforms a treatable, localized issue into a systemic crisis. While colorectal cancer remains a leading cause of death, its predictable biological timeline makes it almost entirely preventable. This split-screen comparison shows a colonoscopy as a physical intervention, stepping into the mutation window to halt the process. During the procedure, doctors use a camera to sweep the colon. By removing a mutating polyp immediately, they neutralize the threat. Screening allows for the removal of a growth before it has the opportunity to become cancer. Doctors recommend starting regular screenings at age 45. This timeline is often moved earlier for those with a family history of the disease, a history of smoking, or a diet high in processed meats and low in fiber. Because cases are rising among younger adults without these traditional risk factors, symptom awareness is necessary for everyone. Monitor your body for blood in the stool, changes in bowel habits, persistent fatigue, a false urge to go, or sudden weight loss. Listening to these early signals and utilizing screening gives you the ability to stop a lethal disease before it fully forms.